Well, welcome all to this event. Thank you all for taking time out of your evening to provide input to DHS on these, the Waiver Reimagine in simplifying the service menu. So we're really glad that you can join us today, and we look forward to hearing your input. If you could go to the next slide, Jim. Great, thank you. So again, today's event is about, it's really an engagement event to ask for your input. We have several breakouts this evening in small group discussion. You'll be joined by others who are part of this event, as well as a small group facilitator. And we'll walk you through all of that here to come in our agenda for this evening. But this really is about engagement and providing input and asking questions. So the focus for today is the simplified service menu and related tools and resources. Next slide. I'd like to start with some introductions. The Improve Group, and I'm with the Improve Group. We are an evaluation firm in St. Paul, Minnesota, and we are conducting today's event. I'm Jill Lipsky-Kane. I'm a managing consultant. And we also have some other staff members with us today who will be facilitating the breakout sessions. My colleagues are Amy Sear, Russell Barnes, Sarah McGarra, Kylie Nicholas, and Jim Nord. And Jim is also our tech person. So if you have any questions, any tech issues, please do reach out to Jim, and I'll give you some instructions here on that in a minute. And I'm seeing in the chat here too, folks, a question came up of, will the chat be monitored? Yes, so Jim is monitoring our chat. And then when we break out into small groups, the small group facilitators will also be monitoring the chat there. So you can use the chat function to ask questions and to contribute your thoughts. All right. So yeah, send Jim a chat if any technical issues come up for you. I want to also introduce the staff from the Minnesota Department of Human Services Disability Service Division who are here with us today. Stephen Horn, Elliot Rankin, and Hannah Lamb. Great. So I've got a little bit of logistics and technology notes. Today we will be using this main room as well as Zoom breakout rooms, as I mentioned. And in the large group, you can turn your video on or off by clicking the image of a camera, which is in the bottom left of your screen. And we've muted all the microphones in the large group in order to prevent any feedback or audio issues. But you will be able to turn them on in the small group if you desire. And you can click on the image of 2 people in the menu option that pops up. To open the participants pane and rename yourself. We are asking those who registered as advocates of an organization, and there's just a handful of you, but we do want to put you all into a small group specifically for advocates from organizations who are here for the event. And so if you could just change your participant name to show that. If you are calling in just on audio, you may need to take yourself off mute and let us know if that is the case. But it's just so that Jim can know which of the participants to put into the small group for advocates. And as with any other technical questions that you have, you can chat with Jim Nord or use the raise hand button here in Zoom. Great. And then I also wanted to mention, just real quick before the agenda, is that if you could please also confirm your attendance at today's event by clicking on the following link and entering your name and email address. And that link is provided in the group chat. And that came from Jim Nord, and it was timestamped at 6:04 p.m. And we will use that information to provide gift cards to people who access services, use services, and family members of people who use services who participate in this event. So we're able to give gift cards to you folks who could join us this evening here. Okay. Great. Thanks for using the chat, folks, for telling us who you are. Jim will help me track the participants here. Great. All right. Let's move on to the next slide here. So for tonight, we have on the agenda that we will provide an overview of Waiver Reimagine project and walk through the simplifying, how the service menu will be simplified. We'll also talk about a new service of integrated community supports. We'll talk about remote support, as well as a conversation around an idea of an online service planning tool. And lastly, we will have a way just kind of round out our time together with a few points on how to stay engaged in this process. So again, the purpose of today's event is to gather feedback that will shape how DHS carries out and communicates about Waiver Reimagine. And we will ask you for your input on the simplified service menu and the drafted service descriptions for the minnesotahelp.info website. We can answer some of the questions about the information shared today. And with that, for particularly in the small group conversations, we may not have the answers to questions that come up. But we are encouraging you to ask the questions aloud and let us know what your questions are, and we will share those questions back with DHS. All right, next slide, please. Okay, at this point, we're going to hear an overview of Waiver Reimagine, and at this point, I will pass it to Stephen.
Thank you, Jill. My name is Stephen Horn. I work in the Disability Service Division at the Department of Human Services. I'm one of the lead policy staff on this project, and I will walk through a quick overview of the project and then the streamlining of the services to create a simplified service menu thereafter. Next slide, please. We'll start with a video that was created for this project. I know it was part of the information that was shared prior to the event. So I believe everybody got this YouTube video on Friday, but recognize that we're all busy and we may not have had a chance to watch it. So we'll start there. It's an overview of the Waiver Reimagine project from our director, Natasha Mers, and laying out the vision that we have with this project and the importance of making our service system work for all people.
Minnesota Department of Human Services, Disability Services Division.
Hi, I'm Natasha Mers, Director of the Disability Services Division at the Minnesota Department of Human Services. My division works with you and partners like tribes, counties, providers, and advocates across the state to ensure that you have opportunities to live the life you want in the community. Thanks for joining us. I'm excited to tell you about Waiver Reimagine. It's a project that will simplify the waiver system and give more options to you and your family. But first, let's start with some background about the waiver system. Waivers are a way to pay for home and community-based services that support you to live in the community rather than an institution. Waiver services can help you take part in community activities and support you at work. For decades, you, your family members, and many advocates have worked with the state to create a system of supports and services that focuses on home and community-based services. Your advocacy has played a vital role in making the system more person-centered and continues to inform the improvements we're making today. As the need for waiver programs grows, the service system must respond and adapt to challenges that we've heard from you, your family members, and advocates. This will ensure you can lead meaningful lives based on your own goals and what is important to you. So what is Waiver Reimagine? We've heard from you that the waiver system is too difficult to understand. You told us that you aren't getting the information you need and that the system limits your flexibility, control, and choice over services. Waiver Reimagine is designed to shift the power balance. It will make the system simpler and give you more control so that you can focus on what is important to you and important for you. Waiver Reimagine began because we heard from you, your family members, and advocates that these improvements are important. Your input will keep shaping our work like it has from the very beginning. Now, let's talk about some of the changes and what they will mean. We're starting with simplifying the waiver services menu to make services easier to understand. The system will be simpler, and you will still get the supports you need. Over the next several years, we will work with you, your family members, advocates, providers, tribes, and counties to make more improvements to the waiver programs. They will be easier to understand and give you more options, control, and flexibility to choose your services and supports. We want you to stay engaged in Waiver Reimagine. Like I mentioned, we started this work hearing from you about how you experience the waiver system. Your input has shaped Waiver Reimagine's goals and the project's course. As we move forward, your feedback is really important to us, as it always has been. We're hosting a series of online events to get feedback directly from you about different aspects of Waiver Reimagine. You can find more information and learn how to engage at the Waiver Reimagine website. We'll regularly update the page with your feedback and how we're using it. Disability Hub MN is also a great resource for you and your family. Links to both of these pages are included in the video description. Thanks for joining us. We've heard from so many of you that you're excited to share your thoughts about Waiver Reimagine. Please get involved and invite your friends and family to provide feedback too.
Waiver Reimagine, an introduction from the Minnesota Department of Human Services Disability Services Division.
So as we are taking this next step in the session today, we are looking at the services to streamline them to make it easier to understand and navigate the services that are available to assist and provide increased choice and control over those services. And it will help make the information easier to relay and interpret and find is our goals with the project. Next slide. So as Natasha was describing in the video, the Waiver Reimagine project has many different goals within it, and recognizing that there are a lot of different changes that are being talked about. The Waiver Reimagine project really is kind of happening in two stages or two phases. And the first phase has been fully approved by the legislature, and we're implementing that as we speak. And then phase two is second, is still in development, but they work hand in hand to take many different steps and stage them in a way that makes the system transition smoothly. So in the first phase, we are simplifying the service menus across the 4 disability waivers, the BI, the CADI, the CAC, and the DD waiver, and also developing an online service planning tool where people and families can learn about and plan for the services and supports that they would like to utilize. The second phase of the Waiver Reimagine project includes simplifying from 4 waivers to 2 and developing an individual budget based on each person's unique services and support needs. Phase 2, those are still in development. And today we're focusing on phase 1 of simplifying the service menu. These changes for phase 1 are targeting to be implemented on January 1st of 2021. Next slide, please. So where we're at right now is that we've recently shared what these changes look like in our regulatory documents, our waiver plans. Those were out for public comment on July 24th through August 24th. And our next step is to submit those amendments to our federal partners to receive approval to be able to shift our services and streamline them to make them easier to understand. And in addition, we're continuing to make the program changes in some of our systems and our computer systems, our manuals, looking at other trainings that we'll have over the next several months in operationalizing some of these changes and continuing to have stakeholder engagement both for phase 1 and phase 2. Next step, please, or next slide, please. So we really want to focus today on the simplifying the service menu. What services we have today and moving to the future, what they will look like. Next slide, please. What we're doing is taking 12 different services that exist today that may be available on one waiver but not the other or another, and simplifying them into a shared service that is encompassing the full scope of the existing service, the current service that we know today. The slide that we see on the screen right now is a table that is moving from the left side to the right side. In the left column, those are the existing services that are available today. And on the right side of the column, in the same row, would be the simplified service name. And what this table is attempting to show is how the existing services that we receive and are available will be streamlined into the new simplified service. So we're looking at this corporate foster care and the supported living service that is corporate. So both of those are in licensed residential settings or foster care settings. That service would be streamlined and simplified into a shared service called community residential services. That will have the exact same scope of the service, the expectation that is providing training and support and access to community resources and community activities of the person's preference. And it at the same time is utilizing our existing regulatory framework. So our same provider qualifications and service license requirements would be pulled into that simplified service menu. And then as we go down throughout to this table, it goes into each service that is getting combined. We have some slides a little bit further that go into more detail of each of those. So I will kind of save the level of detail moving forward in the other slides as the size is easier to read. Next slide, please. And as part of simplifying the service menu, we've heard over a course of many years that there was some service gaps in our service array. And through that, hearing from stakeholders and people receiving services, families, advocates, that we need to make sure we have a robust service array, service options, we designed a new service through multiple years of stakeholder engagement called Integrated Community Supports. And so this service becomes available at the same time we are streamlining our services, simplifying our service menu to ensure that our services are aligned based on where people choose to live. And as we continue to move forward in creating flexibilities of how services are delivered, we are developing a remote support policy or definition that can be globally applied to multiple services to create flexibility to receive services in the way that you prefer. We've learned a lot through COVID in creating flexibilities of how a service may be delivered, but we're also building upon some of the early design work of some current services with that flexibility, but also the goal that we wanted to expand this service option before. Next slide. So each of the next few slides will look a little bit closer in detail about what the existing service, our service menu, and then what it looks like on the simplified service menu. So we have a few different ways that we communicate our policies, and we had asked you in those pre-event surveys to look at how our services are defined within the minnesotahelp.info webpage. It's a resource to be able to search for different providers in your community, different services, both within the waiver programs, but also beyond. But we also have additional information and policy manuals that have a lot more policy detail about the services. And so it's hard to put a lot of that content in here, but additional crosswalks were provided prior. So in here, we're talking about a community residential service that is taking the full scope of corporate foster care and supported living services and combining into a single service that is able to support adults and children in a licensed setting. And at the same time, broadening the scope and putting within the service definition the expectations that we have for the service to be doing the training and supervision, but also emphasizing the community support and community access. Next slide, please. Similar vein, the family foster care and the supported living service foster care or family setting. There's a typo on this slide, so I do apologize. That will transition to a simplified service called family residential services. It's very similar to the community residential services, but it's provided when the license holder, the person who is providing services, lives in the home. These services will provide supervision and training to both adults and children who live in a licensed family residential setting. Again, the underlying license requirements will be pulled forward into the simplified service menu. Next slide, please. Looking at our day services, we have the existing day services include day training and rehabilitation and structured day program, along with the adult day service. This service would be simplified into a new service called Day Support Services. There's extensive stakeholder involvement in designing this service for multiple years to increase the expectation or improve the expectation of what is available to support people in community-based settings. The services are developed or designed to develop and maintain essential and personally life skills so that people who access services can fully participate in their preferred community activities and build skills to seek out or build skills or to explore different passions that they may have. It's a new service that is combining multiple services together and has a robust scope of service. So it's building on the existing scope and including what we have learned and heard feedback from stakeholders. So by combining two services that are not available on all of the waivers into day support service, we are providing a day service that's available across all 4 waivers with the same service scope and same expectation of what can be provided. It is removing the delineation of what is available to a person based on their waiver, and now saying that your waiver is having the same service access across and ensuring that flexibility is there. Next slide, please. The service individualized home support is a service that can provide both training and support into a single service across 4 really broad categories of support that provide flexibility for a person to design a service plan that can meet their unique needs. The individualized home support has 3 levels. There's a without training level, a with training level, and a with family training level. They all provide similar, they all have the same community living service categories, but they have different expectations of what can be provided within the service. Next slide, please. And by saying that, what we mean is that existing services, such as personal support and adult companion, are providing supervision and support, but there's no training component. There's not a part of a plan that enhances or looks at a skill that a person would like to build and trains or provides that training support. So it's solely a support service that's available to adults and children, and it has the same service scope across all 4 waivers. So by merging 2 similar services, personal support and adult companion, into a simplified service of individualized home support without training, we're creating further flexibility and expanding the scope of what is available within that service. It has a broader definition, so it's pulling in the existing and making it bigger to provide that flexibility for a person. Next slide, please. Individualized, the middle, or excuse me, in this slide we're taking 3 training services: independent living skills training, individualized home support, so that's an existing service, and then supporting living services. The 15-minute unit marker is just indicating that it's not the same service as community residential. There are some service naming conventions that are create confusion in making it in multiple different locations and when the service can be provided. So we're taking these 3 services and simplifying them into individualized home support with training. It's combining both support and training opportunities for an adult that's living in the community in those 4 broad categories of community living services. And that gives further flexibility, but it also is simplifying services that have some overlapping scope and makes it a consistent service across all 4 waivers. Next slide, please. And then the last individualized home support service was taking the existing service of in-home family supports and calling it individualized home support with family training. So the service is available to adults and children when they're living with their family, and that the person and their family may have support and training needs. So the service has a broader scope where it's able to support both the person and their family when the person is living in their family home or the family is living with the person. So it's creating further support in the family or the living arrangement, the living environment that the family and the person have chosen together. Next slide, please. So kind of with that, I'm going to turn that back over to Jill. And what we're walking through in those last slides is really where our existing services are today, ensuring that the underlying service scope is pulled into a simplified service menu where we're taking 12 existing services and moving them into 6, and then maintaining some of the qualifications of the service license and the setting license as needed, but creating a simplified service menu for them to be consistent across all 4 waivers. And with that, I'll turn that back to Jill.
Great, thanks so much, Stephen. A lot of activity here in the chat already. Just to reiterate what my colleague Kylie had mentioned in the chat, we are recording the questions and comments that are coming up in the chat. And so while we may not be able to answer questions, I see some folks are responding to people's questions or comments. Continue to do so. Just know that we will be able to reflect on this as documentation and help compile it for DHS to know, what everyone's thinking. So with that, I'm going to talk you through the small group process. You will automatically be moved into breakout room and in Zoom here. So there's nothing you need to do. It should pop up a window that says, it may take a minute or it's fairly quick for us to put you into a breakout room. And that the Improve Group facilitator will ask you questions about some of the services that were described. And that small group discussions for this first one here will last about 25 minutes. And the facilitators will tell you how much time is left for the small group. And you will automatically then be moved back here to the main room or the large group when the time for the small groups has ended. And so we will break out into those here in a second. Next slide, please. First, I have a couple slides I wanted to share with everyone. There are guidelines for the small group discussion. One person at a time will share. That we need to allow time for each person to share. And there are no right or wrong answers. We also ask that folks stay on topic and to please respect everyone's privacy. Next slide. Your facilitator will ask the following questions in the small group. What questions or concerns do you have about the information that was just shared about the service descriptions? What would make it clearer? What services, supports, or situations are missing or not accounted for in this change? And lastly, what information or support would prepare you for this change? All right, so at this time, we will now go into our small groups. All right, so we're gonna hear again from DHS. This time we're gonna hear about details of a new service of integrated community supports. Elliot, I believe this is you.
All right, thank you, Jill. Welcome back, everyone, from your breakout sessions. My name is Elliot Rankin. I work in the Disability Service Division, and I'm going to be talking to you today about the Integrated Community Supports, which is a new service that will be available under the Disability Waiver programs. So Integrated Community Supports is a new service, like I said, so it won't be replacing any of the services that we had talked about before. And as Stephen also mentioned earlier, this is a service that has been developed over several years with input from internal and external stakeholders, people who receive services, case managers, counties, and it will be available on the brain injury and CADI waivers beginning January 1st, 2021. And then it'll be available on the DD and CAC waivers January 1st, 2023. Those are the anticipated dates that integrated community support should be available. And so it is a service that is licensed under 245D, and it provides both training and support in a variety of covered areas. So those areas are community participation, health, safety and wellness, household management, adaptive skills. And what makes integrated community services or supports a little bit different is that it is somewhat tied to the setting where it is provided. So integrated community supports can be provided in a integrated community supports setting, which is basically just an apartment building with 3 or more units that has been approved by DHS. So a provider of integrated community supports will be able to provide that service in a setting where they have an approved report or an approval from DHS. And so part of that is that the service provider has some kind of interest in the building. So either they own the building, or they own or rent a few of the units within a building, or they have some kind of financial tie to the owner of the building. Let's see. So, let's see. So only one integrated community supports provider can deliver that service in a building. Other service providers can definitely provide other services within that building, such as individualized home supports, or they could also be providing homemaking services, home delivered meals, different types of supports to people who choose not to use the integrated community supports. So really, the service is intended to give people more options of where they want to live, who they want to live with, who they want to provide services to them, and how they want services to be provided to them. And I also wanted to mention, there were some comments in the chat earlier about the waiver simplification, or the combining waivers from 4 into 2. So that is something that is happening later down the road. So don't worry, that's not happening January of this year. It is something as part of phase 2 or phase 3, where the waivers would be combined at a later date. So the services that we're talking about today will all be fitting within the current waiver structure of the brain injury, CADI, CAC, and DD. And I think there's quite a bit more information on the CBSM page for integrated community supports that I think everybody should have received, I believe last week or before this session. So if you want to take a look at that and answer the questions that we have ready for you in our breakout groups, that'd be great.
Great, thanks so much. All right, we are going to go back into our small group discussion. All right, folks, we are back here in the main room. This is Jill speaking. All right. Well, let us now move on to talking or to learning about remote support. And I'm going to pass it back to Stephen.
Yes, Jill, this is Stephen. Thank you.
Great. Thank you.
Next slide, Jim. So we've covered a lot of ground, and we're have 2 more topics on the agenda. The next one is remote support. So this is a expansion of some of the service flexibility that is presently available within our waiver programs, but it's very limited. And so what we're doing from a strategy standpoint is to, as part of simplifying some of the services, ensuring that there's consistency across our 4 waivers, is also having a consistent definition of remote support across our program. And this is to ensure that there is the same access that's available within the service, and to provide that modality option across further services. So what is remote support? Remote support is the provision of support within an allowable service. So it would be the delivery of, say, individualized home support without training by a staff or a caregiver from another location or remote location who is interacting with a person through an enabling technology. And so that's a fancy way to just say the technology that is facilitating that communication, to have 2-way real-time communication, such as a smart device, a web conference like this, and it is delivering the service that could be done in person, but through an alternative mean. It is an option that's available within the definition that we're looking at applying beginning January 1st of 2021. That is available when the person is choosing it, and it's appropriate for their support needs. So they have identified how they would like to receive live 2-way communication, and that is documented in the person's plan. I also want to pause for a second and apologize. I do have a Great Dane that is moving a little bit aggressively behind me, or moving quickly, so the added noise. And then additionally, that we want to allow that the remote delivery of a service to be initiated either by the person or their staff. So it can be something that is scheduled, or it can be as needed, really depending upon what the person is needing on a specific day or what they have had part of their plan. There are some limitations to this service or to this support, and that's on the next slide, Jim. So the remote support is the description of how a service may be delivered. It's not the actual technology itself that is facilitating the real-time, the live two-way communication. We have other waiver services that will be available or already are available to be able to purchase some of the assistive technology or technology support that is necessary to facilitate the remote support, or it's already available within an option that a person may have today. So the remote support is not always the fanciest technology gadget. It can be a phone call, is facilitating real-time two-way communication that a person may identify as part of the support need to deliver a service within the scope of the service. Remote support can't be used to provide support that's outside of an allowable service. So it's still looking at streamlining our services and taking that service scope. What can individualized home support with training do? What can day support services provide? That scope of service would then be allowed to be performed within both in-person or through remote support. Next slide, please. And so on this slide, we are identifying which services have we applied a global definition of remote support to, and which services, this may not be a full comprehensive list of services that cannot be utilized, but should capture all of the existing services that we would apply remote support to. So in addition to those streamlined changes that would be effective January 1st, this remote support definition, this global definition would then apply to these services beginning January 1st of 2021 as well. So some of these services already have this flexibility. For example, 24-hour emergency assistance, that service design, the way it's defined, already encapsulates the remote delivery. However, not all three levels of individualized home support historically maybe had that. There was one or two that did, but now moving forward in January 1st, by streamlining our services to have 3 different levels of individualized home support, all 3 levels would have that ability to do remote support within the service, when selected by the person and or their family to be able to provide those supports. So it's creating further flexibility and choices for how people receive their services. It's also a reflection of where we've been working on for many years, and beginning part of this year has really accelerated the need for the flexibility of remote delivery of services. And through that acceleration of what we are experiencing today, that we need to have these flexibilities to be able to respond to a variety of supports that a person may be able to choose and that they want, and that there's not just one option. It's not just in-person options, that we really can expand what we expect a service can do through different modalities. So with that, there would be further training on kind of operationalizing this, but the scope of support is what we are seeking some feedback on. The level of detail that we have within the slides are kind of where we are at today. There has been, obviously our personal experience of utilizing different technology and delivering services in an alternative way. And we're looking at making these changes and applying this global definition of a remote support delivery January 1st. So I'll turn it back over to Jill just to quickly walk us into a small group discussion for a few minutes.
All right, folks, we are coming down to our last topic here. I'm going to hand it over to Hannah with DHS, who will talk to us about a new tool, and it's an online service planning tool. And so, Hannah?
Thanks, Jill. This is Hannah speaking. Next slide, please. So phase one of Waiver Reimagine that we've been talking about tonight also includes building an online service planning tool for people and their families to learn about and plan for the services and supports they might need. The website will offer information about services, supports, budgets, provider information, and just any other benefits to people who are looking to plan for their existing waivered services or who just are looking to learn more and are completely new to the system. So this website, it won't replace any existing service planning that people do with their case manager or their county or tribal social worker. It will be totally optional, and it hopefully will empower people in their service planning to have all the options available to them. So the website will be designed and launched in 2 distinct stages. So stage 1 will have extensive information, but it will just be generic information, but it will all be gathered in one place. In stage 2, which we're developing currently, and we're looking to get your feedback on and your ideas tonight and in future engagement sessions, the online website will be integrated with our state systems, so you can get real-time information about yourself or about the person or your family member, such as active benefits, your next renewal date, assessment information. So we're still in the very early stages of figuring out how the site will work and what information it might offer. So what we're looking for is feedback about what types of information, either about yourself or other services that you might want to know. So yeah, next slide, please. So to recap stage 1, we're currently launching stage 1 that will just be informational. We're looking to have a tool that be similar to Disability Benefits 101 and work within the Disability Hub website that already exists to provide more specific waiver information and information about Waiver Reimagine. We know there are many different places on the internet that offer information about waivered services like MidHealth or the Disability Hub website. So with this stage 1 informational website, we're hoping to gather all the information in one place in a way that's understandable and easy to understand. And the current launch date for that will be later in 2021. Next slide, please. So what we're here to talk about today is for the future website that will be, like I said, integrated with our state systems and be able to offer real-time live information about you, your services, your budget, your assessment. What kind of information would you like it to provide? So I will hand it over to Jill to facilitate on the large group discussion so we can really get your input and your thoughts and ideas.
Great, thanks so much. Yeah, so here we are in a large group discussion. We are finished with small breakout rooms for the event. If you are welcome to take yourself off of mute in response to discussion questions or use the chat function as well. We're here towards at the end now of our event. We've got a few minutes left. I just wanted to wrap things up here. So if we could actually go to the next slide, please. All right, so I want to talk to you about staying engaged. We have had a lot of conversations tonight, and that we are just beginning here. In August, we've got a few other events planned. Really, this is a communication and stakeholder engagement events to gather feedback. We will be hosting these events throughout November. So in September, we will be talking about simplifying the 4 current waivers into 2 waivers. October has 2 events on individual budgeting. And then in November, we will be reviewing the Waiver Reimagine 2021 legislative report. And really the goals are to ensure that people have accurate information, that they can give their feedback, and an opportunity to buy into these changes in service descriptions and simplification. And part of the communication plan is the video, social media, website, and marketing materials. And so stay tuned for more information. And a couple questions popping up is the website is really going to be where we are going to provide the updated information about the upcoming events. All right, next slide, please. And here are those links. Again, they were included in what we emailed you ahead of this meeting. So the webpage is here for Waiver Reimagine. You are welcome to email DHS at the Waiver Reimagine specific email address listed here with any questions or input about Waiver Reimagine. And you can also subscribe to receive the DSD e-list with announcements on by going to the Waiver Reimagine webpage. Okay, and a couple questions I'm catching up here in the chat. How up to date is the webpage? It is up to date as quickly as we can finalize the content and get it ready for their website. It is 8 o'clock, everyone. On behalf of the Improve Group and the Disability Services Division at DHS, we thank you so much for your input and participation in tonight's event. Thank you all and have a good rest of your evening.